Is your rabbit not eating? Is this something you should worry about? Why is this happening and should you visit a veterinarian? I'm Dr. Alicia and in today's video I will answer all of those questions, so stay tuned! Before we start, please consider subscribing to the channel and hit the notification bell as well. That way, you will be notified as soon as we release a new video that will help you become a better pet owner. If your rabbit stops eating, this is usually a serious concern. Unlike many other species who can cope with occasionally missing a meal, rabbits need to eat regularly to keep their guts moving. As prey species, they are hardwired to carry on as if nothing is wrong to make sure they don't look weak to a predator. If your rabbit has stopped eating completely, they are at risk of serious complications such as gut stasis, a gut blockage, dehydration, and liver disease. While this definitely warrants a trip to the vet, there are a few things you can do in the meantime to possibly help your bunny feel better. Many different things could have caused your rabbit to lose their appetite. It would be impossible to list every potential cause, but some of the most common include: Number 1. Dental problems. Dental problems are painful and often cause a reduced appetite. It's most commonly caused by a poor diet, for example, one that lacks fiber. Dental disease often goes unnoticed for a long time because rabbits instinctively hide pain and discomfort. Showing any sign of weakness in the wild would make them a target for predators. The most common dental problems include overgrown teeth, tooth roof abscess, and tooth injuries. Therefore, as a rabbit owner, it's important to keep an eye out for dental problems and check your rabbits regularly. The second common reason for a loss of appetite in rabbits is a gastrointestinal problem called ileus. Ileus occurs when normal peristalsis, the contractions in the intestines that push food through the gastrointestinal tract, decreases or stops. Ileus is extremely dangerous in rabbits and can cause death if left untreated. Ileus is usually due to other problems including stress. Stress is often triggered by what seem like minor events to us, such as a change in housing, loud music, fireworks, or a new pet joining the household. Abscesses. Rabbits are very prone to develop localized infections called abscesses. They can get them just about anywhere in or on their body, for example, tooth abscesses, abscesses behind the eye, or abscesses under the skin by the ear. Dental disease. Poorly chewed food from overgrown teeth can cause indigestions in the rabbit. Inappropriate diet. If the rabbit has too much starch but not enough good quality grass or hay, therefore insufficient fiber intake, this can cause problems. Low water intake can cause dehydration and result in a dry gut. This makes the passing of food along the tract much more difficult as it is dry. Encephalitozoon cuniculi, or E. cuniculi for short, is a protozoan parasite of rabbits that can cause cataracts, kidney disease, or affect the nervous system and cause a head tilt or complete paralysis. Not enough exercise. If your rabbit is not active enough, it can lead to the gut also being inactive, so please make time to play with them and ensure they get enough exercise to help keep everything moving. Diet changes. Changing your rabbit's food suddenly is likely to cause them a level of stress and could have stopped them eating. It can also lead to stomach upsets or diarrhea. If you need to change your rabbit's diet, always transition them gradually over a couple of weeks. Respiratory infections. Respiratory infection can cause a rabbit to feel unwell and stop eating. Stomach ulcers. Stomach ulcers are common problems in rabbits often brought on by stress. They are very painful and often cause a reduced appetite. Urine infections. Urine infections are painful and often cause your rabbits to eat less. Some other potential causes include intestinal parasites, external parasites like lice and fleas, osteoarthritis or joint disease, poisoning and toxins, or tumors. How will I know if my rabbit has stopped eating? Apart from their food bowl staying full or hay left in the rack when it usually all disappears, some of the more subtle signs that your rabbit isn't eating properly may include weight loss, small or less droppings, diarrhea or soft feces, lethargy and hiding away, drooling and a wet chin, tooth grinding as a sign of pain, a wet or dirty bottom. So, waiting until you notice food being left might be too late. How can it be treated? To begin with, despite the cause, it's important to quickly get your rabbits eating again. This will prevent them from developing any complications such as dehydration, gut stasis, or liver disease. If your rabbit has gut stasis called ileus, then they need to see a vet urgently. Veterinarian will be able to give supportive treatment to try and help the situation. In other cases, he or she may prescribe medication for treatment at home or admit them into the veterinary hospital for intensive treatment and nursing care. Treatment is likely to include medication to keep the gut moving and pain relief. When to contact your vet? Contact your vet immediately if you notice your rabbit not eating properly or worse, isn't eating at all. It's important to have them examined as soon as possible to prevent them from developing any further complications. Home remedies. It's not advisable to try treating your rabbit at home unless you have been advised by your vet. Not eating can be a life-threatening symptom in a rabbit if it's not treated quickly. You can try home remedies in the first few hours after you notice that your rabbit stopped eating. Here are some tips that you can do yourself. Number 1. Start with special instant food for rabbits or some mixed vegetable baby food and a syringe. Force feed your rabbit to stimulate its gastrointestinal tract. If your rabbit goes too long without eating, its intestines will fill with gas since normal peristalsis has decreased or stopped. After force feeding, encourage your rabbit to exercise and massage its belly to encourage gut motility. Number 3. Increase the amount of water your rabbit consumes to provide extra hydration. Fill both a clean water bowl and a water bottle for your rabbits to drink from. Syringe water or an electrolyte solution can also be provided until your rabbit is defecating normally. Number 4. If your rabbit is still eating a little bit, offer greens with higher water content such as lettuce or celery, as well as lots of hay. Avoid feeding your pet rabbits pellets at this time. If your rabbit still refuses food, call the vet right away. Remember, a medical professional who has examined your pet and knows its health history can make the best recommendations for your furry friend. That's it for this episode. Thank you for watching and I will see you soon. Bye bye!